The purpose of this video is to help people with understanding of Medicare. It can be very confusing. There's a lot of people affected by Medicare. In fact, there's 11,200 people turning age 65 every day between 2024 and 2027. So we're going to go through some common questions around Medicare, but also we're going to dissect each piece of Medicare, all the different alphabets, and just try to give you a better understanding of how it works together. So questions that we get: should I enroll into Medicare Part A or Part B or both? What happens if I'm still working or my spouse is still working? And why does my employer size matter to whether I elect Medicare A or B? Are there any penalties that I face if I don't enroll into Medicare when I'm first eligible? So let's talk about the pieces first. Part A of Medicare, if you look it up under the Medicare website, anywhere else, it's going to call it hospitalization. But for this video, and I think it just makes it a little bit simpler, let's call it the hospital bed. So for an example, if I go out in my parking lot today, double over in pain, get an ambulance ride to the hospital, have an appendectomy, get sent home tonight, Part A of Medicare would have paid for none of that, even though it happened in the hospital. Part A is the hospital bed coverage. That's what you've been prepaying for your entire working career in your Medicare taxes. Part B of Medicare is more the medical coverage when you think about that previous example. So the trip to the hospital, the surgery itself, the anesthesia, those type things. But Medicare Part B is an 80-20 plan. It covers 80% of the services. And if you didn't have a supplement, if you didn't have an Advantage plan, you could be responsible for 20% of the charges. Next up, and we're just going to go kind of in alphabetical order, try to make it easier. Next up is Part C, which are Advantage plans. Advantage plans, a little bit different. So the federal government asks the insurance companies for some help with the amount of baby boomers coming in. How can we offset some of this risk? And so the insurance carriers invented Advantage plans. Advantage plans is what you'll see advertised on your TV, October 15th to December the 7th each year. But it's very important. You're giving your Medicare A and B rights over to that private insurance company, and then they get to control who you go see, who's in the network. Just because a provider takes Medicare, it doesn't mean that they'll take your Medicare Advantage plan. So just be careful when you're making a selection there. Wonderful resource for that is the Medicare website. Please don't search for it. Go up to the address bar, type in medicare.gov, and you'll see the American flag top left corner, and it says official website of the United States government. Advantage plans most of the time as well include drug coverage, and so that's an advantage, pun intended, to doing that as a one piece. Next up is prescription drug coverage, or Part D. Same open enrollment as the Advantage plans, October 15th to December the 7th, but your Part D coverage is typically for people who purchased a Medicare supplement. Because supplements don't include drug coverage, you have to go out and find your own. The Medicare website is phenomenal. You put your medications in, you put your preferred pharmacy, it will tell you which plan is best for you for the upcoming year. All these plans do reset on January 1, Part C and Part D at least do. And so you can kind of track out your year financially to see what your spend is going to be for prescription medications. Last piece that we're going to talk a little bit about today is Medicare supplements. So Medicare supplements are you keeping your Medicare A and B rights. You're not giving it over to a private insurance company, but what you're doing is you're buying a secondary coverage. So I'm going to keep my Medicare A and B. That'll be my primary insurance, but then the supplemental carrier is going to come in and pick up that 20% for me. Plan G, by far most popular plan, most comprehensive and the most expensive Medicare supplements out there today. Center for Medicare and Medicaid Services does control the supplement market. So if you look at a Plan G, whether it's from this carrier or a different insurance carrier, it's all going to be the same coverage, but maybe not the same premium. So let's talk a little bit about cost and premium. Cost of Medicare. Part A of Medicare, I hear people say sometimes that it's free, and it's simply not. It's prepaid. That's what we paid for out of our paychecks. And anyone who's worked 10 years or 40 quarters is what they call fully insured, so you don't have to pay anything for Part A. Remember, A is the hospital bed as we go through this video. Part B of Medicare, and it's a common misconception. It's $174.70 for a lot of people, but it's not for everybody. Part B of Medicare can cost more based on your income. So if I elected Part B of Medicare in 2024, they're going to go back and look at my 2022 tax return to determine how much I pay for Part B. Your drug coverage, which is Part D, your Advantage plans, which is Part C, and your supplements are all priced by private insurance companies. So you should probably shop around and see who's got the best deal for what you're looking for. So common questions: should I enroll into Medicare A or B? Well, it depends. You probably shouldn't do what your neighbor did. You and your neighbor are not in the same situation, maybe not financial situation, maybe the fact that you're still working. But should I elect Part A or Part B may come down to if you're still working and you have access to group health insurance. If your employer has less than 20 employees, unfortunately, Medicare is actually primary. And most insurance companies now will tell you as a group carrier, oh, I'm sorry, we're going to pay your claims based on the fact that you did elect Medicare, even if you didn't elect it. So working past 65 is fine, but a lot of times you'll still need Medicare because your group health insurance may consider them primary due to the size of the group having less than 20 employees. If you have more than 20 employees, the group health plan is primary, and you simply have the choice. Do I want to go into Medicare A and B today, or do I want to keep the group health plan primary? Another question, penalties for Part B. Are there penalties? Absolutely, there are penalties, but think more of the penalty being if I'm trying to avoid paying for the coverage. If you're still working and you're covered by your group health plan and it's credible coverage, it's as good as Medicare, there are no penalties. The penalties come in when I'm trying to avoid paying my $174.70 for Part B. So I'm healthy. I don't see the need for insurance right now. I really don't want to pay that $174.70 or don't want it taken out of my Social Security check. That's when you could be assessed a penalty. The penalty is up to 10% per 12 months that you don't elect coverage, and it's a lifetime penalty. It never goes away. So just be careful on that. Very similar on the Part D side when it comes to penalties. If you're doing the right thing, if you're covered by the group health plan, you're not trying to avoid enrolling, typically there's no penalties as long as your group health plan coverage is as good as Medicare. But if I turn 65, I elect A and B of Medicare, maybe I buy a supplement and I just decide not to buy drug coverage. Yes, there is a penalty. I can't go more than 63 days without drug coverage, or I'll pay a 1% of the national average premium compounded monthly for every month that I didn't take drug coverage. Common way to get around this. If you're turning 65, you're electing a supplement, and you don't take any prescription drug coverage today, just go ahead and buy the cheapest Part D you can find on the Medicare website. It's a very helpful site. It'll walk you through the least expensive in your area, and if nothing else, you'll have prescription drug coverage and not pay a penalty down the road if you ever elect coverage. IRMA. Another thing that comes up a lot. Can I get rid of IRMA? I did. I'm higher income and I'm paying more than the $174.70 for Part B, or I'm paying an excess fee for Part D. Does it ever go down? My income has gone down. Does it go down? Well, yes, it does, but you can also apply back to the Social Security Administration. It's called an SSA 44. You can simply Google the form. It'll come up in a PDF. You can fill it out, send it back, and just ask to be reevaluated. Yes, in 2022, I made more income. In 2024, I paid that. But if my income's gone down, maybe I would just like to pay the regular $174.70. And that SSA 44 is a way to pretty much raise your hand and ask for a little assistance. A couple of ways to enroll just to make sure that we've got all the alphabets of the Medicare put together. Almost everyone starts with Part A and Part B as the foundation. But then you kind of build from there. So if I have A and B of Medicare, then I would elect a Medicare supplement and a Part D plan. Or I'll start with A and B of Medicare. I'll do an Advantage plan, and it includes drug coverage, and I don't need to do a Part D. What you don't want to do is buy a supplement and an Advantage plan. That's a waste. What you don't want to do is buy an Advantage plan and a Part D if your Advantage plans includes drug coverage. You don't want to mix those two up. It can be very messy. And so just be careful when you're going through the process of not mixing it up. A, B plus supplemental drug coverage, or A, B plus the Advantage plan. Hope you found this video helpful. Please, if you have some questions, first place I'd always go is back to my financial advisor. See if they can give me any resources for whether I should take A or B of Medicare. If that's not working, you can always go to the Medicare website. That's another good resource. It's a free resource to go there. And then finally, if there's a Medicare specialist in your area, that would be the best place to go for help.